down here. Oh, it's recording.
You can hit stop.
Sounds good.
Okay. All right, well, welcome everyone. Thank you for being here. This is meeting room 2. So I just want to make sure that everyone is in the right place. The title of this presentation is COVID-19 and Sexual Health Education, just to make sure that everyone is in the meeting room that they want to be in. My name is Shannon Liu, and I go by she, her pronouns, and I'm the clinical training coordinator at Take Control Initiative, and I'll be your room 2 meeting host, if you will. So if you have any issues, please feel free to use the chat, and I will do my best to kind of take care of them while Jenny presents. And so I do want to thank Jenny for being here. Thank you for being here. Jenny is going to present on COVID-19 and sexual health education. Jenny is a licensed master social worker serving as program director with Amplify Youth Health Collective in Tulsa. Jenny brings 9 years of experience in the adolescent sexual health and positive youth development field and a strengths-based systems-oriented approach to her capacity building work. In her current role, she has the honor of working alongside youth-centered, intentional partners to create and strengthen a collaborative network of services and educational opportunities that support the endless potential of young people in Tulsa. And so to get Jenny started, what I'm going to do is I'm going to stop sharing my screen and Jenny is going to start sharing hers and we're going to get started.
Hi, everyone. It's nice to meet you. And thanks for the warm introduction, Shannon. So as Shannon mentioned, I work for Amplify. And Amplify is a capacity building organization. We support direct service partners, school districts, parents, and ultimately young people to promote adolescent sexual health and well-being, specifically in Tulsa. At Amplify, we believe in the power of young people and their right to self-determination. Research tells us that when youth have access to accurate, comprehensive information about their bodies and about healthy sex and sexuality, the chance to clarify their own values, goals, and strengths, and environments that support and advocate for their growth and leadership, they make the healthiest decisions possible for themselves, right? So our goal is to create a system in which young people are able to prevent unplanned or mistimed teen pregnancy. They're really the ones that prevent adolescent STI transmission. They're the ones who set healthy boundaries in romantic and peer relationships and navigate consent. But it's on us as adults to provide and advocate for the basic tools they need to do that work. So our goal is to build, improve, and maintain a system in which all young people in Tulsa have access to the tools that they need to do that work. Today specifically, I'm going to be talking to you about a very specific collaborative effort that we help to support, which is the district-wide implementation of evidence-based sex education in Tulsa public schools, and the radical out-of-the-box response that that collaboration engaged in during the pandemic. I'll give you a brief overview of what our implementation system looked like prior to COVID-19, provide a response timeline to highlight key decision-making points in the project, review the changes to our implementation system for this school year, and then highlight specific barriers, lessons learned, and successes before opening it up for questions from you all. Before I begin, I think it's really important that I note that while I'm the one up here sharing today, this project is about the collective work. No single organization, and especially not just Amplify, could have accomplished what we've accomplished by ourselves. I've infused some direct quotes from partners into the presentation in itself. And I think it's also important that everybody knows that the foundation that was laid by folks in this work long before I ever got here is what made this possible, right? So the system I'm about to review with you and the critical relationships within that system, if they hadn't been as strong as they were, this pivot would have been a lot more difficult, I think, if not impossible. So we're going to start by looking at a systems map of the model for sex education implementation in TPS. And Shannon, if anything comes through the chat, feel free to interrupt me if you need to. Thank you. So this is kind of a visual of what implementation looks like. You'll hear me use the acronyms YST and THD a lot in this presentation. That represents Youth Services of Tulsa and the Tulsa Health Department's PrEP program. And those organizations each have teams of highly trained, certified sexual health education specialists that provide a menu of evidence-based programs throughout Tulsa County, and specifically provide a curriculum called Positive Prevention Plus to Tulsa Public Schools middle and high school students. And then the collaborative efforts to ensure success for implementation involve several other key partners. First, you see up here TPS SFSS, which stands for Student and Family Support Services. And in particular, their Rockstar Program Manager and Sexual Health Education Advocate, Joya Cleveland, who coordinates the scheduling of all implementation needs with individual school sites. It's really important to note here that TPS has systemized sex education for their students. In fact, they put a regulation into place in summer 2020 to ensure that implementation will occur at the middle and high school levels, and that students will receive, quote, evidence-based, age-appropriate, medically accurate sex education that is inclusive and stigma-free based on the national health standards. So TPS is really setting the bar high in Oklahoma related to this. They've also streamlined implementation by carving out 2 weeks in 7th grade science and high school biology courses. So the program is actually in those curriculum pacing guides at those grade levels. And then at the ground level, each school site has a school counselor or social services coordinator or classroom teacher serving as an advocate for the program. We call these folks our site coordinators, and they are the boots on the ground that ensure that all of the technical pieces, so the parent preview night, the educator overview, those opt-out forms that go home with students, that all of those pieces happen. They also provide us with really critical feedback and data reporting that was more important this year than ever. And we're really grateful to the George Kaiser Family Foundation funding that allows Amplify to stipend those folks for the extra time they spend on this project. Classroom teachers, you kind of see this up here in the learning environment, usually play a pretty minimal role in implementation. So the collective does meet with them before implementation to make sure that they're aware of what's going to happen in their classroom, that they've reviewed the curriculum from a trauma responsive lens so they know how to link young people to appropriate follow-up resources. But typically, YST and THD just kind of take over their classroom for 2 weeks. So this year, there were some really core changes that happened for our classroom teachers, and we'll talk about that in just a second. Parents and caregivers, of course, are engaged through parent preview nights, typically hosted at the school site, and have the right to opt their child out of the program at any time. So parents are, we really try to engage them in what their young people are going to be learning and encourage conversations to continue in the home after implementation has come and gone. Amplify actually holds the MOU with TPS to ensure that implementation is going to happen. So we provide the critical scheduling support through the maintenance of our collaboration scheduling system on monday.com. We convene the group to review feedback, troubleshoot technical assistance needs, and ensure that scheduling is proceeding as planned. We offer regular trainings on best practices and curricula, and then serve in a support role to kind of co-facilitate site communication with YST and THD. So now that you all are experts on how implementation happens, let's walk through a little timeline of what happened beginning in March of 2020. So in March, as I'm sure we all remember, TPS alongside lots of school districts in Oklahoma enters distance learning for the remainder of the 2019-2020 school year. From April to June, really, THD begins their pandemic response assistant. So they kind of move into a role of working what I call like 2 full-time jobs, wearing 2 really distinct hats. And Youth Services begins piloting some community-based classes via Zoom with another evidence-based intervention and providing feedback to Amplify regarding instruction. So how did it go? What was recruitment like? What were the struggles? What went well? That kind of thing. And at this point, we're just continuing our monthly meetings. This is also the first point at which Amplify reaches out directly to Positive Prevention Plus to ask them what's going on with this nationally, right? We know that the state of Oklahoma doesn't have a sex education mandate necessarily for the programming we're offering. They do have that HIV/AIDS education mandate, but other states have a much broader and more comprehensive mandate. And so we were able to hear from Positive Prevention Plus about what was going on in California and kind of start thinking of some preliminary ideas. In July, we adapted our current training model for Positive Prevention Plus to the Zoom format, and we're able to host a training of educators alongside trainers at YST. This is also the time when Amplify receives funding from Charles and Lynn Schusterman Family Philanthropies to purchase our own Canvas instance. And I want to just pause here for a second and say that if we had not been able to purchase our own Canvas instance, nothing that follows would have been able to happen. And you'll kind of see the importance of that as we move through. Canvas, for those of you that aren't aware, is a learning management system, and it's the system that Tulsa Public Schools uses for most of their distance learning pieces. We also go back to Positive Prevention Plus and discuss specific modifications of the program for the Zoom format. Then in August, this is when the ball really starts rolling. So TPS confirms that they're going to be in distance learning for the start of the 2020-21 school year. We start contacting our site coordinators and asking, what is this going to look like at your school site? What's your schedule going to be? We speak with Positive Prevention Plus again about ways to meet the needs of the established distance learning model. And at this point, they provide us a letter of support and permission to leverage their independent study materials to implement a flipped classroom model, which we'll talk about in depth today. With the caveat that as soon as health educators can safely return to the classroom, we will discontinue use of the model. So September was a really, really busy month. This is when we confirm with TPS that we can build out a course in our Canvas instance. We can send it to them and they can upload it to their instance and into their commons, which is kind of like a cloud where teachers can pull a blueprint course and assign it to specific students. So then we get to building, right? We build out courses for the middle and high school. We began meeting with site coordinators again to talk about the distance learning needs at their site, which results in the development of a toolkit. This is a toolkit we've added to throughout the last 6 months as we learn, troubleshoot, identify needs. In September, we also hosted a training through Cardia, who is the training partner for Positive Prevention Plus, on the flipped classroom model, right? So a lot of teachers in California are using this model, and Cardia kind of has a training that goes along with that. Then we debrief with the network, right? And I think our data collection tool in that debrief included a scale, like a confidence scale, where 1 was, I'm panicked, help, and 5 was, I could do this tomorrow, let me run, right? And we heard really loud and clear that more support, including teachbacks, a streamlined process for creating implementation tools like PowerPoints, was needed. So in October, we hosted virtual teachbacks, and the network collaborated to create PowerPoint and run-of-show templates to ensure consistency across educators, right? To make sure that whether or not a young person is attending Rogers or Edison High School, they're going to get a comparable experience. This is also when THD and YSD set their ideal implementation dates for the year. A lot has changed since October, right? So we'll talk about that a little bit too. And implementation for high school began in October. So in about a 2.5 month period, we've gone from, oh, we think we have this idea in our head to we're implementing it, right? From October to today, implementation continues. We continue to convene together weekly on a management and director level and host regular debrief sessions network-wide. In January, we hosted some additional training teachbacks on the middle school content. And then we learned in mid-January that THD was to be called full-time into vaccine response, which is great for the Tulsa community, right? But just some extra appreciation and applause for Youth Services of Tulsa, because they have really stepped up to the plate and identified ways to continue to serve all sites this school year, which is huge, right? So that's the timeline. Let's talk a little bit about what changed, because in addition to implementation changes, which we'll talk about in just a second, all of those sort of connecting pieces in the model that we looked at earlier had to adjust in some way. We knew initially that we'd have to adapt the parent preview night process. So typically YST and THD host evenings at the school site, usually kind of tacked on to a back to school night or parent teacher conference night where there's a lot of foot traffic happening. And it's an opportunity for parents to look at the curriculum, to ask questions. So instead of hosting preview nights for each school individually, we set up a recurring virtual night to be held on the first Thursday of every month. So that Zoom link was included on all parent communication, and translation services is provided by TPS for those meetings. We also converted all of our paper opt-out forms to fillable PDFs, worked with school site coordinators utilizing Google Sheets to create Google Forms templates if that's what they were wanting to use. Now, I will just highlight this as a big learning moment for me. I personally had really high hopes of greater parent engagement through Zoom. Preston's smiling because I know he heard me talk about it a lot, because you don't have to get in your car, right? You just like log on. So we really noticed a pretty significant lack of engagement in those first two events. And so we got to work again, kind of shifting and pivoting, and found a way to meet the need for parent resources outside of those scheduled meetings. So our sex educators got to work recording parent preview night content. We created a landing page on the Amplify website that allows parents to watch that pre-recorded content, review curriculum outlines, and provides contact information for further questions. As we obtained more qualitative feedback from our school sites, the need for additional resources came up. So from this feedback came a virtual sex ed FAQ sheet that includes details about the program, parent resources, information on how students can access the course, and then some general tips for students and families to create the best learning environment for the program. And that goes home to parents with the opt-out forms. Schools also expressed the desire for a fillable template where they could input a counselor's contact information, right? So they wanted to be sure that young people who, as of today, may have never stepped foot in their school building this academic year, knew here's a trusted adult at my school site I can go to. They wanted to be sure young people knew who they could contact with questions and concerns following the program. So if you've ever become familiar with or know about Positive Prevention Plus, you know how holistic it is. It's not just contraceptives or learning about STIs, right? It's talking about human trafficking, relationship abuse, those kinds of things. And so they wanted to be sure if a young person had a concern about abuse or neglect, or just wanted access to more information about community resources, that they knew who they could contact at their school site. And so let's get into it and talk about what implementation this year really looks like. So normally evidence-based interventions like Positive Prevention Plus, or P3 is how you might hear me refer to it, are implemented directly in the classroom. P3 in particular relies on the experiential learning cycle to process content so that young people leave with a sense of, number one, what did I learn? Number two, what does that mean for me individually? And number three, how am I actually going to use it when I walk out of here today? So as you can imagine, shifting to a virtual environment would be a really big change, especially a distance learning environment. At first we thought, okay, we just need to become Zoom experts, right? We need to learn how to translate in-person activities for the Zoom classroom environment. But in August, we learned that distance learning schedules look nothing like typical Bell schedules for a host of reasons that have to do with practicality, engagement, and equity. In TPS, for example, young people do independent work for each class 3 out of the 5 school days in a week, and then meet live for Zoom sessions with their classroom teacher for 2 of those days. And now remember, we've got that 2-week period to work with, right? And school sites, rightfully so, now more than ever are holding instructional time as precious, right? So it's not like we can go back and necessarily ask for a month to try to implement the program. So we had to consider options that would align with that distance learning schedule and ensure completion within that 2-week period. And so we went with the flipped classroom model. And if you've never heard of a flipped classroom before, it's basically a learning approach or a teaching approach in which direct instruction moves from the group learning space to the individual learning space. So young people are going to be sitting on their own, processing all of the content or information that they normally would have gotten as a group in a classroom, right? The idea is that then they come back to the group learning space and you're able to kind of transform that into a more dynamic, interactive learning environment where young people actually apply concepts and then engage in the subject matter a little bit more creatively because they've done this independent learning. So after speaking with Positive Prevention Plus, we learned that folks across the state of California, where their curriculum is most widely disseminated, had been doing this already during COVID. And so educators were leveraging the independent study materials and then engaging in processing of those materials, facilitating additional skill building activities, and answering sensitive questions once they had young people together on a Zoom session. And so that's what they gave us their support to do. And here is an example of what that would look like for you if you were a second hour biology student at Rogers High School this year, right? So in the blue, you see the modules that they're completing on their own. And then the Zoom sessions are kind of sprinkled in alignment with the distance learning schedule. So the educators log on with a prepared series of recall and processing questions about the content. They do engage in some actual skill building activities that have been modified for Zoom. So using things like Poll Everywhere or Google Jamboard as a way to keep them interactive. And doing anonymous questions, which can still be submitted. And we'll talk about what that looks like. The Canvas course itself is in kind of module format. And so this is a screenshot that kind of shows you lesson 3. There's a place where they go to kind of watch a video. Then there are associated worksheets available in English and Spanish and a final wrap-up quiz. In every module, there's going to be a link to the anonymous question box, which is a Google form. They can type their question in, put their teacher and class period so it goes to the right health educator. It was really important that we ensure classroom teachers had the capacity to track attendance and give grades during implementation. The wrap-up quizzes serve as that mechanism, and they're really just content-based. Most of them are true or false, and then there's a little bit of reflection at the end. They also allow the school sites to provide us with detailed data about who is actually engaging in the content so that we're able to look at and compare program reach this year versus last year. We also knew that young people were going to need access to community resources, right? So we were able to create just like a local community resources landing page that we've sprinkled into the modules throughout the course. And so young people are able to click on here, read a little bit. If they have a need, it takes them either to an Amplify resource page or a partner resource page, depending on what the need is, so that they are still able to get clinic access, access safe place, LGBTQ plus resources, and those kinds of things. And then I mentioned this briefly before, but this is just sort of what they see when they go to the anonymous question box, which when they click takes them to a Google form where they can submit their questions to be answered. Okay. We relied a lot more on our classroom teachers this year than we ever had before, right? They're the ones that are going to have to pull that course from Commons and assign it to the young people in their room. They're the ones that are going to have to provide us with the data afterwards. And so we've really gotten to know how to support them in a more intensive way this year. So our educator overviews, of course, still happen, but we've also developed a toolkit for them, which includes a Zoom tip sheet. That tip sheet walks them through how to pull the course from Canvas, how to upload educator videos, and then some basic Zoom functions that are really helpful during implementation, because we found that there's a lot of different comfortability with technology, and just because it's a function that we find helpful doesn't mean it's one that they've used in their classroom before. And so we've kind of integrated that into there. We also include that grading schedule or that assignment grid that I showed you earlier, so that when they pull it and imprint it, they can see clearly which modules belong on which date, that kind of thing. And then a data reporting template, which was actually developed by one of our phenomenal site coordinators at Rogers High School to systemize gathering completion report data. So this was a lesson learned along the way. Always have a template for anything you're asking more than one person to do. It will really, really help. In terms of data collection, everything went to Qualtrics or Canvas. And so we collect demographic and outcome data through Qualtrics, and course completion data through those wrap-up quizzes and metrics provided by the classroom teacher at the end of implementation. And Shannon, I don't know if it makes sense to pause here, but if there are any questions about like the implementation process that have come up, I'm happy to answer those before diving into challenges and lessons learned.
Yeah, does anyone have any questions for Jenny at this point?
It's okay if not.
Jenny, I don't know that I necessarily have a question, but you mentioned Qualtrics, and I'm not sure everyone is like probably that familiar with what Qualtrics survey software is, and maybe how dynamic of a tool that is and a resource for moving forward that we have collected all of this information. So is there anything you can share about Qualtrics?
Qualtrics is just going to be like an online survey tool. You probably, even without using it before, have probably used it at some point for something. I don't know. This is not collective approved yet, but I think in terms of having real-time access to data, it's very helpful for us as opposed to paper surveys, and could be something we could continue using even when they're back in person. Okay. Let's talk about challenges.
Jenny, there was a question in the chat from Allie Kate Phillips that says Megara Bell said, what are considerations for racial equity re-sex ed program?
Yeah, so I think one of the, when you say what are, maybe, can you say more? Like about the curriculum specifically, or about this implementation process? Also wondering if we're going to see any of the materials, any of the above. Yeah. So Positive Prevention Plus is a, as delivered live and in person, right, is an evidence-based intervention that's been evaluated across multiple demographic groups, right? It's gone through a pretty rigorous randomized control trial. And so, and review in that way. In terms of access to the information this year, one of the things regarding this issue, okay. In terms of access to the information this year, I'm going to highlight some data for you, because one of the questions that we're really asking ourselves is, who are we not reaching, right? When I get to the slide and I kind of show you the breakdown between 4 different high schools that we have reached data back from this school year, you're going to see a pretty big disparity between some of those school sites. And so one of the things that I think the collective is thinking about and working on is, number one, how do we assess who we didn't reach this year? How do we assess what additional needs exist outside of even an evidence-based intervention, right? And then how do we meet those needs urgently? Did that answer your question? Okay, perfect. So let's talk about it a little bit more deeply. The first challenge that I think we would really highlight is the urgency and timeline of the response, right? So we radically adapted a system, trained the network, and streamlined tools for implementation in the span of about 2.5 months, once we knew what those distance learning schedules were going to look like. So as Stina highlights for us, the immense amount of work that THD, YST, and Amplify engaged in was huge, right? And had to be kind of built from the ground up. The second challenge is that we would highlight is engagement, right? So people hopefully become health educators because they love working with young people. And if you've ever taught in a classroom, you know what that energy feels like, right? This year, educators are behind screens, students' cameras are usually off, and students stay muted. So tools like Poll Everywhere, the chat box, and Google Jamboard have really reframed what engagement looks like. It's nearly all through chat, text, or polls. And so Chris shares the impact of losing that nonverbal cue in the classroom, right? Which we know can be really crucial to building rapport over time. And also being able to know, are the young people understanding what I'm saying, or are they interested in what I'm saying? So that has definitely been a challenge. And then another piece is the independent study, right? So the reality is not all students are engaging in the curriculum based on our pacing guide, as much as we'd like for them to, right? And so it's not uncommon for young people to show up to class having yet to engage with those Canvas modules. And the health educators are really rolling with it. So Natalie highlights this by talking about how she tries to teach in the middle, right? Of maybe some students have engaged and we can leverage that knowledge, and some students who haven't yet done the coursework, but that's a challenge, right? And then just like the participant mentioned earlier, there are other issues at play here that make this system not accessible to everyone in the way that a live in-person implementation might. You can see here, right, school A, we had a 27% reach this school year, whereas the year before we had a 92. That's a really, really big drop. School B, we had an 88%. This was a school site that we were not in last year because of COVID, one of 3 that could not finish implementation last year. But you can kind of see the differences and really where additional resources need to be targeted as we move into 2022. In terms of lessons learned and lessons that we're taking with us through 2021 and beyond, the reality is Zoom requires a different skill set, right? Skill building in Zoom facilitation has the power to inform future implementation efforts with students who have been doing online learning for a long time, training facilitation, and the use of technology in ways we'd never considered before we were forced to consider it, right? So getting comfortable with silence, Making sure you're engaging in that chat box and reading your room differently are all things that Natalie highlights for us. This year's also really required incredible flexibility, both psychologically, right, and with program delivery. The reality is evidence-based interventions were not built for this kind of learning, as Dina shares, right, that our programs need to be more inherently flexible. And so just using this as a moment to say that we need more innovation in our field in this area. And our hope is that the pandemic has highlighted this for our curriculum partners to take with them as well, and that we'll see more of that come up. Additional lessons that were, I don't even know if I would call these learned, but I would call them reinforced, right? And the first is accessibility. So accessibility for this year included pieces that were definitely within our control, right? Translation of the course text, making sure there were closed captions on those videos, and then pieces completely outside of our collective control in the moment, like internet access, right? The fact that these videos don't exist in Spanish. That doesn't mean that those aren't issues we shouldn't be working on and advocating for in the advocacy arm of the work that we do. But it definitely, COVID has highlighted a lot of things that we already knew were contributing to inequity in this environment, right? Interpretation and translation, right? So these were really, really, really important when thinking about once we send this off, right? We may never actually see those young people in a live Zoom session. Hopefully we will, but it's possible that a young person may engage with this content without meeting with a sexual health educator. And so ensuring that all of the instructive text was translated into Spanish, that all of those videos did have at least have Spanish closed captioning, even if there was not like a voiceover. Interpretation itself remains a really significant concern, both for online and in-person learning. And we have to continue our collective work to respond to the multilinguistic population within Tulsa. Special education, right? So this model was not built for many students with disabilities. COVID has highlighted what we have known to be true, that we need evidence-based interventions specifically for young people with intellectual and developmental disabilities. And so we have to continue the forward movement on identifying interventions and support for this group of young people in Tulsa. And then we have to continue to ask the question, who didn't we reach this year and why, right? And how are we going to respond to that? I don't have the answers for you today, but if I've learned nothing else in the last 11 months is that we will find a way, we will figure it out, and we will not stop until we have forward movement on that. And then there are just a couple of successes that I'd like to celebrate with you all before I kind of close out for questions and answers. And that's that the program did continue, right? Many young people in Tulsa still had the opportunity to access this information. And without these efforts, they wouldn't have received any school-based sex education. So Brandon highlights this for us, right? That students were still able to be reached and that they were still able to receive the information needed for them to be successful. Another great highlight comes specifically from Joya related to commitment and innovation. So the effort demonstrated by everyone's commitment to do their part to make sure implementation this year was accomplished is admirable. The pandemic took a toll on all of us, and collectively responding to strive towards providing quality sex education required a lot of innovation and flexibility. And then I just want to highlight one last time that the established relationships, leveraging the strengths of the different organizations involved in this work, and the trust, right? The inherent amount of trust that I think was present between all organizations, because there were a lot of crucial conversations that we had to have. And there are a lot of difficult things that we're still discussing in terms of how do we reach people that this wasn't accessible to, that I think make us stronger together than apart. And so Gabe Lowe of Youth Services of Tulsa shares that as well, right? That this is the epitome of a collaborative effort. We understand we cannot all do it alone. COVID has exposed so many cracks, issues, and problems in the world. But now I know from experience, it can also show how strong, resilient, and even adaptable collaborative efforts can be. And so related to that, you know, it's what's next, right? So over the course of the next 6 months, we are not going to stop dreaming big, and we're not going to stop doing difficult things. We'll continue to refine and improve on what we're doing right now. We'll continue to search for long-term independent study solutions for TPS's new virtual learning academy, which will continue operations in the future and is a fully independent virtual learning option for young people. We will engage in a full-scale debrief at the end of the program year to reflect, document, and ensure lessons learned come with us in the future. And then engaging in outcome data analysis to look at outcomes from live learning to this year's model. So that is what we've done and where we're going next. Thank you for listening, and I'm happy to answer any questions that you might have.
That was awesome, Jenny. So much great information. I'm going to go ahead and stop the recording, and then we can do the question and answer session.